Hello, welcome everyone. Welcome to today's Journal Club, and thank you for joining. Today we'll be discussing a paper about how community groups can harness their power to address inequities in public health from our June issue, which focuses on reimagining public health. I'm Jessica Bylander, a deputy editor and correspondent at Health Affairs. First, a bit of housekeeping. Questions can be submitted throughout the presentation using the Q&A tab at the bottom of the Zoom control bar. So feel free to submit questions anytime. You don't have to wait till the end, but we will answer the questions, as many as possible during the Q&A portion of the event after the presentation. So as a note, Journal Club events like these are typically exclusive to Health Affairs Insider members. That's a community offering exclusive access to content beyond a traditional Health Affairs subscription. And thank you to our insiders who have joined us today. If you're attending this event and you are not yet an insider, we encourage you to join our membership community today. Health Affairs Insider is actually celebrating its second year, and as a promotion, you can use the code INSIDER@2 throughout the end of the month for $40 off a new membership at healthaffairs.org/subscribe/individual. So today we are delighted to be joined by Clara Long, an author of a paper in our June issue entitled Community Power Building Groups and Public Health NGOs, Reimagining Public Health Advocacy. In interviews with representatives of 22 national non-governmental public health organizations and 13 community power building organizations, Long and her co-authors explored the nature and potential of partnerships between public health and community power building organizations. They then suggest ways to close advocacy gaps within the public health ecosystem and strategies for how public health can strategically leverage its power, resources, and expertise to support social justice campaigns and movements. Clara Long is the Director of Policy and Organizing at Human Impact Partners. She's responsible for developing and implementing HIP's overall strategy for policy, advocacy, organizing, and research in support of social movement partners. As a human rights lawyer, her strategies, research, and advocacy contributed to campaigns to abolish an immigration detention system in which people are dying because of medical neglect, to transform border policies that criminalize and abuse migrants, and to bring back people deported to harm in the racially discriminatory deportation machine, among others. She works with HIP staff to enhance the organization's capacity to build power with social movements. And Claire graduated with honors from Harvard Law School and holds master's degrees from the London School of Economics in Environment and Development and from Stanford's graduate program in journalism. She is an adjunct professor of human rights law at the University of California at Berkeley as well. And with that, Ms. Long, I will turn it over to you for your presentation.
Thank you, Jessica. I really appreciate Health Affairs having us here and getting this opportunity to speak a little bit about our paper in the Reimagining Public Health issue. I'm going to be presenting on community power building groups and public health NGOs, Reimagining Public Health Advocacy. And as Jessica mentioned, this presentation will highlight the key findings from our study that explores how public health can better support community power building organizations in their advocacy efforts. So next slide. To begin with, I want to set the stage. I want to tell you a little bit about Human Impact Partners. Human Impact Partners transforms the field of public health to center equity and builds collective power with social justice movements. Our work focuses on three core approaches: direct policy and organizing work, bridging relationships between governmental public health and community power building organizations, which we're going to hear about a little bit more in these next couple minutes, and also building capacity within governmental public health to operationalize health equity and racial justice. Next slide. So this is the authorship team. We had support from Fry Evaluation, Maddie Fry, and Emma Waugh from Holland Public Health Consulting, as well as this excellent crew of people from HIP, from Human Impact Partners. Go ahead, next slide. So to begin with, I want to set the stage for why this topic is so critical. Community power building and community power is essential for achieving health equity and racial justice. And we have this definition up here, which is from the Lead Local Initiative. Community power is the ability of communities most affected by structural inequity to develop, sustain, and grow an organized base of people who then act together through democratic structures to set agendas, shift public discourse, influence decisions, and hold decision makers accountable. Community power building organizations are at the forefront of this work, building community power, organizing people based on shared experience to take collective action. On the next slide, we have a sort of some examples of who these community power building organizations are and networks thereof. So what we call national organizing networks, groups that are made up of a membership of community organizing groups: People's Action, Faith in Action, Jobs with Justice, Right to City, Center for Popular Democracy. We are going to be using, and we talk about a lot in the article, this acronym CPBOs, Community Power Building Organizations. So these are, again, organizations that support base building, often around a geography, neighborhood, like a city or a state, a demography or an identity, youth, workers, people who are formerly incarcerated, or an issue like workers' rights or environmental justice. Go ahead, next slide. So, HIP's work, which I talked to you, which I sort of briefly described previously, has brought us into contact both with the potential and the barriers when working to achieve health equity, while recognizing the centrality of power to that work. We shape our work around the understanding that health equity will not be achieved without building community power and directly engaging in social determinants policy change. At the same time, policy change efforts are often led by national community organizing networks or these local CPBOs, community power building organizations that I just mentioned, and larger social movements which engage in strong advocacy to make policy change. And that's been the case not just now, but over time. And we also see from where we sit in terms of our work that public health has a strong infrastructure to draw on, a lot of data, many values-aligned practitioners, but cross-movement relationships are generally weak and undeveloped. Go ahead, next slide. So what did we do? We wanted to explore how to bridge this gap. And we did this by conducting a national landscape scan. The purpose of the scan was to understand what it would take for non-governmental public health NGOs to build relationships with and provide advocacy support to CPBOs and the wider social justice movements they lead. So we had two phases we had a phase of data collection and a phase of analysis. In the data collection period, we completed interviews with national community power building networks, organizing networks, 13 of them, and then use those interviews to inform a set of interviews with public health NGOs, 22 of them. And then we took the findings of these interviews, extracted key takeaways, created some, using both established and found some emergent categories, developed themes, and identified key findings, which is what I'm going to talk to you about today. Go ahead. The next slide is going to tell you, give you sort of a quick look at the organizing networks and CPBOs we spoke with. And Jessica, if you can advance one more. Or sorry, Debbie. These are the public health NGOs that we spoke with. So you can sort of get a sense of who we're talking about here. Go ahead, next slide. All right, so here's where I'm going to start to talk you through what we found. One of the key findings is that many public health organizations lack a deep understanding of power and community power building. So as one interviewee noted, within the public health field, there really isn't a robust understanding of power and the need for power building and power as a determinant of health. Public health NGOs we spoke with were in some cases also unfamiliar with the CPBO networks leading social justice movements and the impacts that that work has on the public's health. This lack of understanding we found limits the potential for public health to effectively support CPBOs in their advocacy. Next slide. Conversely, we found that a lot of the CPBOs we spoke with actually don't know what the field of public health does. There's a lot of confusion about how public health relates to healthcare. Although when we spoke with them, we found that the field's focus on social determinants of health resonates for them. The one quote down below here is, while our climate and environmental justice organizations are not an expert on public health, it is the reason our communities are organizing. Health is a very salient frame for these organizations and for the communities they organize. Go ahead, next slide. One bright spot in this is that public health NGOs have a lot to bring. They have experience in advocacy tactics, including the provision of research, data, reports. This is one of the primary ways that they reported being able to support CPBO campaigns and movements, but they also reported that there was a lack of relationships with those groups as a barrier to being able to provide that support. Next slide. And despite that lack of relationships, in our interviews, it came out clearly that the CPBOs really value their partnerships with public health organizations that they have so far, and they see them as strategic. They see them as adding value to their campaigns. They think public health can serve as validators. They can provide the data and the scientific backing to affirm the lived experiences of community members, and that can be very persuasive with policymakers. However, they need partnerships to be built on strong relationships in order to be effective, so that public health and CPBOs can move together in a way that does not cause harm and that moves the collective goals forward. Next slide. We found also that public health being understandably consumed with threats to its authority and its capacity to protect the public's health, that actually public health and community power building organizations are facing the same threats, including attacks on the public sector and democracy. CPBOs we spoke with recognize that those attacks are part of a broader authoritarian project that undermines both public health and social justice. And so we found, our analysis is that there's a potential for alignment in defending public health if both sectors understand and communicate their interconnectedness. If people understood public health's role, one of our interviewees told us, they would come to defend it. People maybe don't understand the attack on public health. Taking control of public health, demonizing it is not good for all of us. So this desire and potential for alignment against shared threats came out pretty clearly. And then lastly, next slide. We found that a core group of public health NGOs really want a coordinated ecosystem and clarity around roles to support CPBOs. That this is a a clear theme where we see a real desire and interest for greater coordination to lead to more consistent and effective support for community power building efforts. As one interviewee put it, we need more coordination because we're all trying to swim in the same direction, but we don't know what each other are doing. We also need more coordination in order to build relationships and trust effectively. One interviewee told us having a coordinated approach might lead to more consistency in how non-governmental public health partners show up. And that consistency could go a long way toward building the trust that would allow for deeper relationship building with CPBOs, which would in turn help them to advance their social aims. So, next slide. Where do we go from here? HIP is doing just this. We are forming a coalition together with other interested and excited public health NGOs, an organized body of non-governmental public health organizations that cultivates and builds support for community power building campaigns and movements for social change. We envision a coordinated public health ecosystem that is strategically advocating for the policy priorities of CBPOs, many of which are CPBOs, which are shared with public health. And we're envisioning a world in which this coordination allows public health NGOs to use their voice and power to align with and advance social justice campaigns and movements, whether for housing or economic justice, climate justice, or others. And the reason why we're doing all of this, the reason why we're taking this step is because we believe that this coordination will support a transformation and strengthening of the political, social, environmental, and economic drivers of health equity and racial justice. We're doing it because we want to achieve health equity, and we want public health to see itself as part of movements to achieve that transformation. So I know we have, next slide and last slide, we have some time to discuss. And I'm really happy to share this research. I'm really interested in the questions. We from our vantage point, community power and health are inextricably linked, and we're really excited about the opportunities that there are to align the public health sector with the kind of advocacy that will make changes leading to health equity for all. Thank you.
Thank you. Thanks, Clara, for sharing these details from your paper. Again, as a reminder, questions can be submitted through the Q&A tab at the bottom of the screen. And while we're waiting for those, I have some questions as well. So yeah, I couldn't agree more. Power, and specifically community power, is really gaining a lot of attention as a key structural driver of health. It's been getting more attention from funders, academics, and others, particularly in recent years, but it's not a new, obviously, phenomenon or concept. So I'm just curious when the concept of power and power building kind of was introduced into the work at Human Impact Partners, and has it always been foundational, or did you sort of discover, we focus on these other drivers of health or determinants of health, but really need to start focusing on power?
That's a great question, Jessica. You mentioned my bio, and I mentioned before we started this call that I'm a transplant to public health. I'm a human rights lawyer. I've worked for 15 years in the framework of human rights, and I came to HIP about 2 years ago. And when I came to HIP 2 years ago, power was very firmly understood as central to making change. So I can't actually speak to much of HIP's history, but what I can say, from my perspective, from the rights, the civil rights and human rights perspective, is that there has been a growing understanding within that field that is similar to, and in some ways behind, public health's understanding of power, that we need to make change, that the way to make change is by shifting power to those who are most impacted. So it's been a fascinating ride over the last couple of years to enter public health, which has this very well articulated understanding of power. I've learned so much from the way public health research and frameworks think about power, and yet it doesn't seem to be doing taking up its full potential on acting on that understanding. And it's been an interesting shift coming from this world of civil rights and human rights advocacy where there's a lot of acting, but I think less understanding. So
Thank
that's
you.
what I have for you on that.
Yeah. Several questions popping up in the chat, so I might bounce around a little and some kind of feed into other questions I had. First, a very practical question: how can public health organizations join the coalition? I mean, it's interesting to see that you are forming this coalition. I think in the paper you recommended such a coalition be formed. So would love to hear more about it and how organizations can join. And also, are CBPOs part of the coalition as well?
Yeah, thank you so much. We know we're at the early stages of joining, so I don't have an answer for you yet. We've had at this point 2 in-person convenings to design and build out and develop a vision and an set of operating values for this coalition. And as part of that, we're in a name selection process. And there will be a way to join this coalition, but we don't have it yet. What was the other part of your question?
Will this be mostly the public health organizations and then like in consultation with
Right.
CBPs, or are both kind of like essential members?
Yeah. The coalition will move in deep accountability with community power building organizations, and whether that will look like membership or an advisory council or a mixture of those things in different ways is something that's still in formation. But the idea, and is very much in the DNA of this project, is the idea that we need to be bringing our voice, our power, our advocacy to the priorities that are articulated by those who are most impacted, and to those who are building power around those priorities. So that will mean that the advocacy goals, the actions are sort of deeply intertwined with existing campaigns for social determinants, for improvements in the social determinants, political determinants of health. And that will be done in deep accountability with CPBOs.
Great. And one comment was just they didn't catch finding number 6. I don't know if we would pull the slides back up or just talk about them.
Sure, I can pull them back up here.
Thank you.
Yeah, so I think we
Which one
want
are
to
we
go
looking
forward
for?
a few.
Finding 6.
Yeah.
Thank you.
So we explored with our public health NGO interviewees this idea of what would be the value for them of coordination with each other to support community power building organizations. And the finding here really is that there was sort of this core group of public health NGOs that were deeply interested in more coordination, to gain clarity around their roles. To some extent, this is not on the slide, but to build capacity in terms of supporting power building, and crucially, to ensure sort of a relational integrity, to have a consistency to showing up that would build trust between the public health sector and these social justice movements.
And actually, kind of what you're talking about building capacity leads into another question, which also I think is a really important question. So someone in the chat said, often when collaborations are established with CBPOs, there can be a tension around taking advantage of the organizing work that the CBPOs are doing to further advocacy efforts without supporting the growth and power building efforts of the CBPOs themselves. So has that been considered in the work that HIP is doing?
Yeah, absolutely. I mean, I think that there's the concern over co-opting work that's been done, not giving credit where it's due, and also in some cases, creating obstacles or blockages to the actual power building work is perennial. And when we try to sort of bring these professionalized nonprofit sector organizations into relationship with social justice movements. And at HIP, we have a number of different ways to approach this. I encourage everyone to check out our research code of ethics, which you can find on our website. And I can put a link in to that in the chat, which is a document in which we've thought through the ways that research can be done equitably, with transparency, together with social justice movements, and that includes things from as specific as compensation for research participants, but more broadly, the design and the creation of sort of the ways that the research is constructed, how the knowledge that we're constructing is developed. With respect to the coalition, that's certainly a live concern, and something that the initial founding members are keeping deeply in mind. I would remind you all, though, that what we found in our landscape scan was very much this desire, this appetite from CPBOs to have public health show up in advocacy in places where they define. And so there's, there is a call for public health to show up and to use its power in Congress, and but also more broadly in public opinion, and in its framing power and its research power. And so, that's a good signal that we're in a zone where we can help and not harm, or support and not harm, be in solidarity even and not harm.
Yeah, you mentioned the importance of building strong relationships. So I imagine thinking through, how to make sure it's not one directional or extractive, or kind of only limited to, to time or funding. So not just showing up when you need something, but kind of building those long-term relationships.
Absolutely. Yeah, and one of the ways that we've thought about this as we design this work, especially with this coalition, is that we need to start taking small steps and work our way up through up a staircase of both trust and commitment. So the small steps will be small at the beginning. It'll be, a public health letter to support a regulatory change. It'll be, these sort of very defined advocacy interventions. And from there, we think that we can work to build the relationship and trust that's needed to be more deeply intertwined.
Great. Another question speaks to the fact that this study was limited to non-governmental organizations. And you mentioned in the paper, among the reasons was that governmental organizations kind of don't see themselves as having that active lobbying or advocacy role, or just kind of are uncomfortable kind of being in that space. So what roles do you see public health departments or like state, local governments playing in this space?
Yeah, in the beginning of my presentation, I mentioned, HIP's work directly with governmental public health, and also our work bridging governmental public health and community power building organizations. So I would encourage folks to check out that program and that work on our website, the bridging program. We're running a set of cohorts of public health departments with community power building groups who, for a period of 6 months, learn together, build relationships together, work on improving the social determinants of health in their communities together. And this goes to the core of one of the ways that we see change happening, which is to have an inside-outside strategy where government and community power building in particular can develop the relationships that are again strong enough to make the change that's needed for the public's health. When it comes to the work that we're doing with public health NGOs, as you mentioned, because of perceived and sometimes actual limitations on advocacy. And of course, just a reminder for everyone, advocacy is much broader, and there's a lot that you can do that's advocacy and not lobbying. So I think there are a lot of perceived constraints when it comes to public health NGOs as well, and that we'd like to make sure to clarify. But because those governmental constraints are different, we're engaging in this work on this public health coalition building with NGOs particularly. But from our organizational perspective, I would say we very much see governmental public health as being in a position to build similarly, to focus on relationship similarly in a similar way, and to focus on power and how their relationships can help to shift power in the communities in which they work in order to improve health equity.
Yeah, and speaking of advocacy, I think in the paper and definitely on the kind of in HIP's, website and other things, you talk about advocacy as a core part of public health practice. I'm just curious, is that a controversial statement? Is it kind of how has the role of advocacy in public health changed over the years? Has it always kind of been a core part, and sometimes people are a little squeamish to go there, or what do you think?
Jessica, you've got me again as a public health transplant. But what I will say is that we are seeing increased appetite across the sector and increased recognition that advocacy is necessary. And we see that, in efforts to fight back against threats to public health authority. This recognition that, oh, actually, there's a political field out here that's happening, and if we're not going to enter it, then public health is going to get steamrolled. And I think that recognition is in many ways, is resonant with the recognition that that's actually true of not just fighting for public health, but fighting for the public's health. And that advocacy is central to both of those things. Public health as a sector can focus on and invest in fighting for the public's health, we think, as a way to actually retain salience and the power and the goodness of the sector.
Yeah. Someone in the Q&A mentioned community power also connotates an element of governance. Have you heard any hesitation or intrigue by the public health field in sharing their own decision-making powers directly with communities?
Yeah, that's a really interesting point and question. And what it brings up for me are some of these, when it comes to this public health NGO work, is something that came out in the landscape scan, was how much the decision-making within public health NGOs about what to do advocacy on is kind of happening behind a veil. It's not actually totally clear why big public health organizations, non-governmental organizations, when they're making decisions to throw their weight behind something from an advocacy perspective, and what the reasons behind that are. I think that there's of course a whole nother area of considerations when it comes to governmental public health that I'm far less qualified to speak to, but certainly this idea of shared governance of priorities is central to what it means to shift power, regardless of where you're looking, either in the government or non-governmental sector.
Mm-hmm. And how do you measure or characterize power? And then there's kind of a part B to that question, but we'll start with that. How do you sort of measure that, if that is measured in your work?
Yeah. Well, if we go back, that slide I had about what power building is, I can pull up the language that I have on that slide, but essentially, power is the ability to affect the conditions that are shaping your life. I'll cross webinar reference right now to say that HIP just had this just released a report about the impact of corporate landlords on health. And we wrote a research report, and we also wrote an action agenda for what public health and other local government actors can do to shift power around for tenants who are experiencing the health impacts of corporate landlords who have heightened profit-seeking motivations and use profit-seeking strategies in ways that really concretely harm tenant health. And one of the examples that came up in that webinar was a colleague, and I've actually had this experience too, whose child had very high lead levels as a small baby. But both I and my colleague, it was an incredibly scary situation. But because we have a level of power over our living situations, we were able to take the actions that would reduce the risk and reduce the harm to our children. That's not the case if you're a tenant who can't reach your corporate landlord, who's living in uninhabitable conditions, and who doesn't have the support of local government, of the health department, to push back against extremely powerful actors. So, that's not a totally neat definition of power. I think the one on the slide is a lot better. But just an example of the ways that power really does determine your health outcomes.
Yeah, and then they add on that note, is there a framework for determining which partners are most advantageous to work with or have the most influence? I know there's like ways to do power analysis. Are there particular
when we're talking about community power building organizations, is that the question?
Mm-hmm. Yeah, I think in terms of building power in a community, are there and who to partner with, are there frameworks to determine like who has the power, who should I be kind of in a coalition with
like
to share
who's
that
building
power?
Are you talking about on the CPBO side or both sides?
I think on both sides in
Yeah.
terms of like who, like in the effort to shift power, how do you determine who has the power and who should be partnered with?
Yeah. We are, so let me just speak from the perspective of the landscape scan first off, and like to tell you a little bit about how we selected who we spoke with on both sides. The community, HIP has been doing work with community power building organizations for a very long time. And so we started the landscape scan speaking with community power building organizations. We chose the groups that we spoke with as a mix of organizations that HIP has a relationship with and has worked with, and understands their approach in terms of relating to power building work, which again, back to the definitions that I have in the slides, but involves connecting people around shared experience to come up with a set of priorities for making change together. And we also included power building organizations that we knew of or have a little bit less intense relationships with or have less history with, but that we understand their structure and processes to be really privileging this work of community organizing, essentially. When it came to the public health NGOs that we included in the landscape scan, we had a mix of NGOs that we perceived as high power from the perspective of advocacy, ones that are more recognizable, that would be sort of taken very seriously by policymakers, and groups that we saw as high appetite. So ones that were very much aligned with the idea of using their voice, their power, their research, and to do advocacy on behalf of and with community power building organizations. So we created this sort of mixture of those those different categories. We also spoke with a couple academic institutions in the public health field that are looking, very explicitly at this question of advocacy for social determinants change, in order to get their perspective about how that educational process is going and where the field is. So that's how we chose the landscape scan. When we talk about how we choose projects in the policy and organizing work that I lead at Human Impact Partners, we really do, we work to build relationship and build partnerships with organizations that are just very concretely doing that organizing work. And in a way, that organizing work, it's really hard. It's like, it's community meetings, it's one-on-ones, it's building relationship. It is a whole sort of stream of tactics that result in people being in closer relationship, being able to define shared priorities. And so we look at groups that are using those tactics to build a future that is full of health equity and has and brings us sort of a shifted approach to the policy decisions that and the policy areas that we work on.
Great. We had a sort of broad question to talk more about social determinants of health. I think I might focus it a bit. We know that social determinants of health are sort of like the factors about where we live and work and play and other factors that drive health, but not necessarily are sort of healthcare being one of them, but other living conditions and working conditions. So I was struck kind of by a comment in the paper from public health groups that certain social determinants are viewed as kind of like non-health. So like workers' rights were viewed as like a non-health determinant. Mm-hmm. So they wouldn't necessarily focus on them in their work. So I'm just curious, like, any thoughts on how to respond to that perception, or how and should public health provide support on what they perceive as kind of social determinants that are not in their normal purview?
Yeah, thank you for that. I think that there's a lot to unpack there. For me, it's a little bit, there's a little bit of a way in which I don't, I don't have the sort of field level sectoral context to understand how public health decided that workers' rights or worker economic justice was not so much in their purview because of social determinants. I mean, as someone who's come in from the outside of the last couple of years into the public health field, I have this understanding of a history of public health work that where public health workers partnered with factory workers to improve working conditions as some of the very first public health work, the very first work to improve the public's health. And so for me, as a somewhat, as an inside outsider, I feel a little confused, to be honest, about why public health is drawing those lines and where that came to be. It seems pretty clear to me, based on the evidence that I've seen, that the conditions that people experience at work, the fairness of the wages that they get, the benefits that they get, all of these are determinants of large parts of their health outcomes. And I would urge the sector to recognize that and to sort of look beyond what's considered the traditional social determinants. I wonder if, to some extent, there's been a way in which some social determinants have been ignored or cast aside because of how central they are to political power and to organizing. And I guess the whole thrust of this paper is to ask the field to reconsider. What does it mean to take a close look at the things that are actually determining the public's health and see how the field can contribute to changing them?
Thank you. Another question is, what are some things public health practitioners can do to advocate for power building organizations on their own, outside of their own public health organizations?
Well, you could Google the words Public Health Awakened. Public Health Awakened is a project of Human Impact Partners, HIP, and it is a national network of public health practitioners who are taking action on behalf of and with community power building organizations and campaigns. You can join the listserv, see opportunities to take action with Public Health Awakened and get plugged in that way. I think, there is a lot of opportunity at a local level to bring public health voice to local policy struggles. There's one of the things that Public Health Awakened members do, and that anyone, public health practitioners can be doing, is to show up with social justice movements, with power building groups, to advocate for the changes that we need to see at school boards, at county board of supervisors, in state legislatures, with their public health perspective and with their public health hats on, writing op-eds, explaining how social determinants policy is impacting health and why we need to change it in order to have better health. So we think that there's a lot of potential there, and we really urge practitioners to be out there and to use their voice. There's a way in which the white-coated doctors, I think, at the forefront of climate campaigns and others, have been incredibly helpful, and I think public health can also be incredibly helpful in many arenas.
Thank you. Another question from the audience. Not totally sure I'm capturing it, but you had a slide showing the different community power building organizations, and then types of non-governmental public health organizations. So wondering if there's any tips about how to enhance priorities among adjoining or even perhaps competing interests that are represented by all those groups together.
So is the question about the field of community power building is not totally aligned in and of itself. So how do we navigate? Is that sort of the gist of that question?
I wonder if the person would like to chime in with more on their question, but that certainly, I think, could be an interpretation, or the field of public health NGOs might not be aligned about what issues they want to focus on.
Yeah. Yeah, there are a number of different organizing traditions and analyses of what's needed in this moment. Oh, maybe someone is chiming in.
Just in the chat, they chimed in yes. So I think your first interpretation of the question was what they were wondering.
Jessica, I just gave Olivia permission to speak.
Okay.
Oh, great. Hi, Olivia.
Can you hear me?
Yeah.
Yep.
Oh, yes, that was what I had in mind. Also, if you had other tips as to how others who might be wanting to engage in similar work could, so to speak, ease this collaboration in addition to that other aspect that we were just starting to get into.
Yeah, I love that. Thank you so much. I recently became aware of an exercise that was done to determine, what are the sort of key elements of organizing that we will need in order to move into the future that we want to see. And the upshot was that we need to figure out how to provide care, to have caring economies, to have caring communities. And we also need to figure out how to be in generative conflict. And I think, Olivia, what you what you may be gesturing at is that even, in all of these sectors, in the organizing sector and also in the public health sector, there's spaces of conflict. HIP's approach to that is to try to lean into generative conflict, to figure out what we can learn, to build where we can, to center our relationships. I mentioned earlier when we were talking about this report that we've just released about the health impacts of corporate landlords. We did that report with the advice of a group of folks who we pulled both from public health, but also from power building groups and organizing networks who are approaching the issue of housing and health in different ways, and who have slightly different perspectives and priorities. And through working in this advisory group, they aligned on this research and this analysis of the health harms of corporate landlords. So there was sort of a space that was convened to hold a conversation about what we needed to say about health and this issue. So that would be, I guess, those are my first reactions. I'd be really fascinated, if it's okay, Jessica, to hear more about where that's coming from for you, Olivia, and how that has played out.
Okay. Thank you.
Great. Well, I think maybe we'll have time for one more question, unless Olivia, you wanted to add anything else.
I just what flashed through my mind were some of the tenets of, say, things like restorative justice applications, trying to get folks to want to really enhance this toward a place where everyone can benefit, where it's a win-win situation, rather than putting up the objections that I'm sure that you encountered along the way with some of this. As you said, it's not easy.
Yeah, I love that. And I think that call out to restorative justice lands really well with me. Yeah, that we both have to act and to advocate and to center our relationships and to not throw anyone out. I appreciate that there's this thread about how do we be in generative conflict together as we do this work.
Yes, thank you. Sounds like great work.
Thank you.
Great. My last question is just, do you have other research planned to build off these findings, or what other questions do you have about sort of the relationship between public health and community power building that you wish researchers would explore?
At this point, we have action planned. We want to put this into practice, and we want to find out what's needed to build an ecosystem that stands up and advocates for the public's health together with power building organizations. And of course, there will be evaluation that will be built into that, and public health is so good at that, so I love that. And we'll evaluate how well we're taking action, and that will result in knowledge and understanding. I think that there's a lot. One research question I'm interested in is how did public health get so clear on its need to challenge corporate power when it comes to sugar sweetened beverages and tobacco? And how do we reverse engineer that for the fossil fuel industry and corporate landlords and other places in which corporate power is concretely harming health? That's a thing I want to know. I'd love to see more research about that. I think in general, this question that you raised, Jessica, or you might have brought in from the chat about what's considered a social determinant, or what is sort of the traditional social determinants and what's not, is something I'm very curious about, both sort of the history of that and how it changes going forward, so that the sector can be truly effective at protecting the public's health.
Well, thank you so much, Claire, for presenting your work today. Thank you to the HIA Insiders and Unlimited members who are on the call, as well as to the rest of our audience. So as we mentioned, this article is part of our June theme issue on reimagining public health. So definitely check out this full issue and all the related content, which includes our issue briefing, which we held on June 5th, as well as some podcasts. And you can visit the landing page, www.healthaffairs/reimagining-public-health to access all of this content. This issue was supported by the California Endowment, the Robert Wood Johnson Foundation, Big Cities Health Coalition, Public Health Accreditation Board, Center for Innovation, and the Kaiser Permanente funds at East Bay Community Foundation. We also have an upcoming event that we want to make you all aware of. So on Wednesday, July 10th, from 1 o'clock to 2 o'clock p.m. Eastern, Health Affairs Editor-in-Chief Alan Weil will host a lunch and learn event called Supreme Court Wrap-Up, where he'll discuss with panelists health and healthcare policy decisions that are expected in the closing days of the Supreme Court's 2023 to 2024 term. And you can find out more information about this and other health affairs events on our website, healthaffairs.org. So with that, thank you again, Clara, and to our audience today for joining.
Thank you so much.
Thank you. And we are now adjourned.